Breast cancer is the most commonly diagnosed cancer in the United States, and it's the number 2 cancer killer of women. Most of you probably know that October is Breast Cancer Awareness Month, but do you really know what it's like to go through treatment, a mastectomy, and recover afterward? In this video, I'm going to be talking with Erin, a stage 2 breast cancer survivor, that's going to give us some insight on what it's really like to go through a breast cancer diagnosis. Before we jump into my talk with her, let me introduce myself. My name is Jelena, and I'm a stage 3 colorectal cancer survivor. Before I was diagnosed in May of 2016, I thought I was healthy and doing everything right to avoid getting cancer. It turns out that even when you're doing everything right, you can still get cancer. But being healthy can help make your body a little bit stronger to endure those treatments and surgeries. Make sure that you stay tuned until the end of the video because I've got a really important question for you, my viewers. Now, that's enough about me. Let's move on to my chat with Erin. Hi, Erin. Welcome to my channel.
Hi, it's great to be here.
Let's introduce you to the audience by having you tell us a little bit more about yourself before your cancer diagnosis.
I am an 11-year breast cancer survivor, so my life before cancer is a bit long ago and vastly different from what it looks like now. But pre-cancer, I was living in the DC area. I was diagnosed at 27, so I was in my early and mid 20s, working in a career in marketing and fundraising for nonprofits. And really just kind of leading that very high stress, I'll work no play, or work hard, play hard kind of life, and really sort of just feeling like, oh, I need a change. This isn't what I want to be doing long term, but not really having a good direction on where I wanted to go. And just really in that sort of like quarter life crisis period of, your mid 20s of like, what am I doing? And then I got diagnosed with cancer, and that sort of turned everything upside down.
All right. So, did you experience any symptoms before your cancer diagnosis? And if so, like how long from those symptoms until you actually received your diagnosis?
Yeah. So I really didn't have any symptoms per se. I did find the lump in my left breast on my own. I wasn't looking for it. I was actually at the beach and I was putting on a bathing suit and just sort of like adjusting, and I felt something weird, and had my boyfriend look at it and say, like, what do you feel this too? Is this feel odd? And so I kind of monitored it for a little bit, just to not really knowing what to do about it. I did go see my primary care doctor, who said, oh, you're young, it's probably nothing, but luckily did send me for a mammogram and a sonogram. Again, got the mammography, got the sonogram. They're like, it's, it doesn't look particularly angry, but you're young. Let's just do a biopsy just in case. And did the biopsy. And so all along I was sort of just prepared for, this may not be much of anything. And then it was something. So that kind of adds a lot of additional complications to it.
Yeah. So, how long was it from when you first found the lump until you kind of received your diagnosis, and what ended up being your diagnosis?
Yeah, so I believe, if I remember correctly, felt the lump around 4th of July of 2010. And I didn't go right away. I think I started like at the doctor around sometime in August. And it took a little while to like make appointments, and I wasn't super like, oh, I need an appointment like right now. So it took a few weeks. And I was actually diagnosed on September 29th, 2010.
Okay. So it wasn't too long of a time
Yeah.
from that initial thing. So then what stage was your diagnosis, and then what did your treatment plan look like?
Yeah. So I was diagnosed with breast cancer. It was initially a little on the border, and they weren't quite sure. I had a pretty large tumor. It was 9 centimeters. But they were picking up part something called DCIS and part invasive cancer. And DCIS is ductal carcinoma in site 2. It's actually considered sort of a stage 0 precancer. So they were getting a lot of DCIS in the biopsy sample, but they were also saying this is a really large tumor for just DCIS. So I actually had a couple biopsies to really pinpoint the diagnosis. And what it turned out to be was DCIS, so this precancer that had started to progress into invasive cancer. So it was, I guess, sort of on the early side, but not as early as it could have been. But ultimately, because of my tumor size, I was diagnosed with stage 2 breast cancer. And then treatment wise, again, because I was young, they tended to be more aggressive. I think, my treatment may have looked a little bit different by today's standards. It was 11 years ago. There are some tests that they do now that were in very early phases that they didn't do on me at that point. But they went aggressive. So I started with chemotherapy. I had 6 rounds of an ACT combination. And then I went to have a mastectomy. So I had a single mastectomy on my left breast. And I was fortunate that there was no lymph node involvement. So therefore I did not need radiation. And I ended up having reconstruction on my left breast, and I had a breast reduction on my right, so that they would ultimately match at some point. And then I did tamoxifen for a handful of years afterwards.
So how long was your recovery from your surgery?
Yeah, so I ended up having 2 surgeries. So the first, how they did it with me and how it's done with some breast cancer is you have the initial mastectomy and they put something called an expander in, and basically like sort of stretch out the area. And then a number of months later, you actually get the implant put in. So I think I had my mastectomy in March of 2011, and I had my expander put in September of 2011. So actual recovery from the mastectomy was a couple weeks. I can't remember exactly how much time I took off, maybe 4 weeks, though it really was not that bad. I felt like chemo had prepared me for far worse. So after chemo, the surgery seemed like, oh, this is easy. Maybe not easy is the right word, but much less taxing on the body than chemotherapy. And then the second surgery for the implant was really much easier, and that I only took a week or 2 off.
Do you have any tips for others that are facing a similar surgery on how to prepare or what to expect during recovery?
It can be really hard on your upper body. So, there's a lot of rehab exercises that you can do before and after surgery. One thing that people really like are to buy like wedge pillows, which help you stay propped up in bed, because it's really hard to lay on your back, and you can't lay on your sides in those early days because you have drains, and it's just a whole thing. And then another tip that people really find helpful is just plan to wear a lot of baggy button-down clothing, and zip up the front bras, things that you don't have to put over your head, where you don't have to lift your arms all the way, because it's pretty sensitive and tender in those early days. And then, I think the biggest piece of advice is just not being afraid to ask for help and support from your friends and family.
Now, you mentioned that you probably will have drains. Do you want to elaborate a little bit more, like for somebody that's unfamiliar with surgery and the concept of the drains? Can you talk a little more about it?
Yes, drains. So drains are these fun, essentially tubes that stick out of your body near the surgical site. And these clear plastic tubes have like a bulb on the end, like a squishy plastic bulb, and basically drains excessive fluid and like blood out of your body from the wound site, which is pretty common after some surgeries. And so you'll usually end up with at least a few drains that may be removed at different time periods. So, you'll leave the hospital with maybe 2 or 4 of them, and then, you'll have to sort of care for them and not shower. and actually take the bulb off and drain the fluid out, measure the fluid, report back to your doctors on how much fluid is literally draining from your body. And then once it gets down to a certain amount, right? Like, so once it's not draining as much, they'll say, okay, well, this drain can come out. And so they don't all necessarily come out at the same time. You may have one that's ready to take out after a couple of days. You may have one that lasts for a week or two. Usually, I think most people within 1 or 2 weeks are probably drain free, though they're obviously everyone heals differently. But your doctors, monitor you through that whole period. And then usually I think they just remove it in office. It's pretty quick and simple. They just kind of pull it out and the hole closes up, and it seems really, really creepy and invasive, but it's actually pretty simple. And more annoying than anything else, I would think.
So then, did your diagnosis cause you to make any big changes in your life since you had it kind of so early on?
Yeah, I mean, I think that's probably the biggest thing that came from my cancer experience was, I was really thrown and shook by the whole diagnosis, right? This wasn't anything I was planning on. I didn't have a significant family history. It was not in my 10-year plan. It was not something I was thinking was going to happen to me. I very early on, before I started my treatment, made sort of this pledge to myself that, okay, if I have to go through this, I'm going to take everything I can from this experience. I'm not going to let it be a wasted experience. I'm not going to just go through it and then put it behind me. Like, I'm going to learn something from this. I'm going to do something from it. After I was done with treatment, you sort of find your way, and that survivorship period for anyone that's gone through, being treated for cancer and becoming a cancer survivor is really brutal. The readjustment into, everyday life is pretty challenging. And I, came back from treatment and had this really shiny, new, great perspective on life of, I'm not going to let things stress me out. My job was pretty stressful before cancer, and I just refused to let myself worry about the mundane details of my everyday job. And, when I found myself becoming emotionally impacted by that again, I really just felt so strongly that I need to draw a line in the sand and say it's not worth it. I did not go through what I went through to be stressed out by dumb stuff. And so I pretty quickly decided, like, this is not what I want to be doing. I'm really feeling compelled to sort of do something with cancer. I, had gotten connected to other young women who had been diagnosed with breast cancer. And that to me had been one of the singularly most important and profound things that had helped me through treatment, was that connection to others. And so I really felt pulled to help other people find that. I ultimately got to the point where I just decided to quit my job and look for work in the cancer realm. So I ended up going and finding a fundraising job at a cancer support nonprofit in Washington, D.C. called Smith Center for Healing in the Arts. And over the years, I have kind of become more ingrained, and my role there has changed a lot. I started out in fundraising and development, which was what my background was in, but I kept getting pulled more and more into sort of programmatic work. I kept being called to do that more. Like, that's what I wanted to be doing. I wanted to be working with people. I wanted to be helping them not feel alone during this. I wanted to, be more involved. So I actually ended up going back and getting my master's in social work. And I have now been at Smith Center for over 9 years. I'm a licensed clinical social worker. And I run support groups and do some individual therapy, and I do programmatic work, and I, have really kind of built this whole new career in life out of, this thing that happened to me 11 years ago. And so it's been really fruitful. And I feel like I have fulfilled that pledge to myself of I did something with this, right? Like, I'm never going to say that I'm glad I got cancer. But I will say that, I'm really proud of what I made the experience. I'm proud of, the hard work I've put in and the drive and direction that I was able to find from this really terrible thing.
You were only 27 when you were diagnosed, and you didn't have any children at the time, correct?
Right.
So can you talk, was fertility discussed with you at all when you were diagnosed, and kind of how did that go?
11 years ago, yes, there were conversations had about fertility in general. They were not as well done or pushed in the way that I believe they are now for most people. So it was actually not brought up to me. My mom actually asked about it, asked the oncologist during one of our appointments. And she was like, oh yeah, I mean, you could do fertility preservation if you want to, but I mean, you're so young that you have like a 75% chance that like everything will be fine. So it's up to you. But if you do, then we're going to have to delay treatment. So you just let me know. So that was what was presented to me. And I, did have a long-term serious boyfriend at the time, but we weren't married. And, I wasn't ready to make decisions about kids yet. And it just wasn't where my head was at. And I was also really freaked out about this cancer and I wanted it out of me. And so I ultimately decided that I was going to kind of roll the dice and not do fertility preservation, and just move forward with treatment because I was scared. So that's kind of what happened. I mean, I can't say that it wasn't talked about and it wasn't presented, but it wasn't really like pushed on, like, you really should consider this, or this is an option that you have and it's a valid option, you should think about it. Like, it was a very kind of blasé, like, conversation about it, like, you could if you want. So I don't know whether I would have made different decisions if it had been presented in a different way. I've really tried to give myself grace of, I made the best decision that I could for me at that time with the information I had. And so, I did end up getting married to the person I was dating at the time. And eventually we did decide to try to have kids. And I found out that my fertility likely had been impacted, and I had low ovarian reserve. So it wasn't impossible for me to get pregnant, but it was just a lot harder. And so we tried for a while before we pursued fertility counseling. And then once we saw a reproductive endocrinologist, then we decided to move forward with attempting some egg retrieval and IVF. And that ultimately was not successful for us. So we did try this for about a year. And at the end of the year, did not have anything from it other than some medical debt that expenses that we had put towards this procedure. So we took a break, and I, at this point I was like 36, 35, and decided to just say, okay, let's just sit back and see what happens and reevaluate. And, I don't want to keep throwing money at something that maybe isn't going to happen. So we kind of just hit pause and just continued on as like, we'll just see what happens. And I would say about a year and a half later, I just randomly got pregnant. So after 5 years of trying, both on our own and with the help of technology, which was unsuccessful, I got pregnant. And it was the weirdest thing, because I just had started to try to come to terms with the fact that this may never happen and I may never have a kid. And I was starting to find some acceptance in that. I still was really upset about it, but I was at the point where I was turning that corner. And then all of a sudden there's a positive pregnancy test. And it really kind of took a minute for me to like wrap my head around it. And I spent my entire pregnancy sort of like waiting for the other shoe to drop. Like, okay, it's going to be a miscarriage. Okay. All right. Well, something's going to happen, or there's going to be something wrong. Or, I just spent 9 months just convinced that the worst was going to happen. And it didn't. I have a very healthy, almost 2-year-old son. And he's perfect and amazing, and everything went fine. I had a really easy pregnancy, which was amazing. And I like to tell people that like try to give me crap about that, I went through chemo when I was 27, so I deserve an easy pregnancy now. So it worked out somehow. I never believed it would, and I'm still kind of in shock that it happened. But I'm so grateful for our son, and the fact that, it was a bit of a miracle that he was meant to be.
Yeah, that's awesome. So
Yeah.
it started out very, very rough. And
Right.
then you finally had a awesome surprise, and all that breath holding that you had turned out, yeah, to give you the result of a wonderful little baby boy.
Yeah, nothing I could have predicted, but here we are.
That's great. So now, do you continue to experience any side effects from your treatment?
That's a great question. I think, you know, 11 years out, I don't have a ton of physical side effects. Luckily, obviously I have an implant in one breast, and that means that I have a numb left breast, and I don't have a nipple. And so there's some physical changes and physical things that are different that I've, adapted to, and it's not what I would want, but it's there. But I think probably the biggest thing that sticks with you is that emotional and mental toll, right? Particularly that fear of recurrence. And as you get further and further away from diagnosis and treatment, it becomes easier. It becomes less part of your everyday. But I will not say that it is gone. It crops up at random times. You feel something weird. You have a weird side effect or a weird pain or a weird, you think you feel a lump in your breast, and you just have a moment of just sheer panic, right? Your stomach drops, and you're like, holy crap, is this it, right? Like, is it back? So while that doesn't happen weekly, when it does happen, it can still be very, very, very jarring and very intense. And you learn the skills of like how to cope through that, and how to talk yourself off the ledge. And I've been very lucky to date that I've not had any legitimate recurrent scares. But certainly that fear, that thing in the back of your mind. And I would say that, now that I have a child, like that fear is like even more kind of present of, what if it comes back? What's going to happen? And so I really have to stop myself from going down those rabbit holes at times, because it's not here, and I don't have it, this hasn't happened. And so I think that anxiety that so many cancer survivors live with is there, right? It's just, we've seen it, we've known it, we know that it can happen at any time. And so you just sort of have to learn how to live with that uncertainty.
What has your follow-up schedule looked like after you finished treatment? I forgot to ask about that.
Yeah. So follow up from treatment. So it starts fairly intense and then weans over time. So in the first year, I think you go like first it's weekly during treatment, and then it slowly tapers down when you're done with treatment to, monthly, and then every 3 months, and then every 6 months. And then, after a year or two, they get you to really where you're coming back every year. And so for the first 10 years, I saw my oncologist and my breast surgeon once a year. And so I would just alternate. So every 6 months I was seeing someone. They would do a clinical breast exam, and I would have an annual mammogram on the one breast I still do have. So at 10 years last year, my oncologist told me that I didn't need to come back and see her unless there was a problem. I could if I wanted to. I decided that I was going to just stick with seeing my surgeon once a year, getting the annual mammogram, and having the clinical breast exam. And then I'm only going to go see the oncologist again if I have symptoms, right? If there's something wrong. So that's kind of where I'm at. So it's definitely a weird phase to move into where um, it is behind me to some extent. It's not part of my every day or my annual anymore. It's I guess once a year I have to really do something about it. But I feel like I have moved into this new phase, and it doesn't mean that, I don't still have a risk of recurrence. It doesn't mean that it's not still something that is present for me, but it's been nice to sort of mentally kind of shift a little bit and feel like I'm moving into that next phase of survivorship.
Yeah. Okay. So I think most people know that October is Breast Cancer Awareness Month and are used to the flood of pink that inundates us all month long. So can you talk a little bit about your emotions, your mixed emotions about the month?
Yeah, absolutely. I think, oh, Pinktober. um, First of all, my first introduction to Breast Cancer Awareness Month, where I was actually aware of it, right? Like I've lived much of my life prior to cancer and knew it was there, but it really didn't impact me at all, or I didn't really give it much thought. But being diagnosed on September 29th means that you get thrown headfirst into pink everything the minute that you are, also being thrown headfirst into, oh, hello, you have breast cancer. And I found that to be incredibly overwhelming because I've just been given this really, really, life altering diagnosis. And then all of a sudden I'm reminded of it every single place I turn, right? I turn on the television, there's commercial. I turn on a football game, all the players are wearing pink. There's pink ribbons everywhere. So walking into that as a newly diagnosed person was incredibly overwhelming of like, I can literally not find anything that isn't reminding me of breast cancer in this moment. So that was really tough in that moment. So I've always kind of had this very mixed feelings about Breast Cancer Awareness Month, just because of that, like really first emotional slap in the face that I got. And now, as time has gone by, I have learned a ton more about it. I've learned a ton more about the dynamics of it. I've done a lot of advocacy work. I know a lot about the history of it, so I have a far more nuanced opinion of it now. I think there is certainly a lot of good intentions that come from it. I would be very remiss if I didn't acknowledge the origins of it, right? Like it really started out as this way to bring awareness and give voice to breast cancer survivors, and I think all cancer survivors, during a time when we didn't talk about cancer. This really evolved in sort of the 70s, the 80s, when people just didn't say, I have cancer. You would whisper it like, she has cancer. And it, because of the work of some of the early pioneers in the breast cancer movement, we now can talk about it, right? We can be very public about breast cancer. We can be very public about all cancers in a way that we didn't used to be. So I think that is amazing. And I think that the early foundations and the intention behind it was pure and true and incredible. As with most good things, it becomes altered and diluted and just taken and in so many different directions that I don't think were intended. And I think that's where we are with it now. As someone who works with people who have all different types of cancer, I certainly know that there is a lot of mixed emotion among other cancer survivors, non-breast cancer survivors, of like, they get a whole month and everybody cares about breasts and nobody cares about colons, or nobody cares about thyroid. And, I cannot imagine like how much of a punch in the face it feels like in October when literally everybody's talking about that and nobody does the same thing for other cancers. So on one hand, like that's, it feels very unfair. Breast cancer gets far more funding than I think, any other cancer, as far as research goes, and even resources, which can be really frustrating at times too, especially when you're trying to help someone find resources and they don't have breast cancer. So there's a lot of pros and cons, but I think, ultimately what really angers me about Breast Cancer Awareness Month and Pinktober is all of the pink washing, right? So I don't know how familiar you all are with that term and concept, but essentially not dissimilar from another concept of greenwashing, basically where a company says, for the month of October, I'm going to make my product pink and I'm going to talk about Breast Cancer Awareness Month. And I'm going to say that if you buy this product, we're going to support breast cancer. It's a very elusive marketing trick, right? It's a marketing tactic to get people to buy your product. And 9 times out of 10, there is not much information given about where the money that you're spending on breast cancer goes, right? Or if you read the fine print, it says, we made $100,000 donation to this charity. And, what I take from that is it doesn't matter if I buy this product, you already made the donation. So it doesn't, there's no incentive for me to support this. Most of the time, the money doesn't actually go to research, which is the thing that would actually help end the disease. It very rarely goes towards metastatic breast cancer research, which is the only type of breast cancer that actually kills. So there's what started out as this very well-intentioned, like, let's bring awareness, let's give this a voice, let's give survivors a voice, let's make it so that we don't have to hide this anymore, has now turned into this whole month of marketing and a whole month of exploiting, the breast cancer experience. And I think because the color is pink, it also gets associated with being very girly and being very pretty and like tutus and tiaras and ribbons and bows and all this stuff. And breast cancer isn't pretty. It sucks just like every other cancer. You still get poisoned, burned, cut, through your treatments. You become disfigured and deformed. You deal with body image issues. You have long-term side effects. It's not pretty. And, this whole notion of fight like a girl and being brave and being a warrior, it serves some people, but it's also not helpful if that's the only message we're putting out there of like, you have to be pink, you have to be strong, and, buy my bucket of fried chicken that's pink because I'm going to help, right? It becomes very disingenuous. And so I think a lot of breast cancer survivors feel anger by that, you're exploiting my disease now, right? Like, yes, we have a lot of awareness. Yes, we have a lot of research money, which is great. I'm not going to take that away, but now you're exploiting me. So it's complicated.
Yes, it is. Thanks for that explanation of why it's complicated for you and for many other survivors, I'm sure.
Yeah.
So what's a fun fact about you that many people may not know?
So one fun fact that some people may not know about me is that I actually won my wedding because I had breast cancer. So I, on a whim, I had a friend send this to me, this like, enter your story and you could win a wedding. So I said to my boyfriend at the time, we had been together for a long time. We sort of weren't officially engaged, but we weren't not engaged. We'd been through cancer together, so we knew we were going to be together. I said to him, like, hey, there's this contest to win a wedding in Colorado. I don't really have anywhere that I feel like we should get married. And, would you mind if I entered it? And he was like, sure, why not? All the while thinking, we're never going to win this. So I submitted our story and they picked us. So then all of a sudden we were engaged and we were planning a wedding within a year. And it was amazing. It was this amazing organization called The Wedding Pink, run by a woman called Cheryl Unger, who was a breast cancer survivor herself. And they award a wedding to a couple that's been impacted by breast cancer every year, and they're based out of Colorado. So that's the connection. My husband and I had never been to Colorado at the time, but we said, let's do it. Like, this sounds amazing. So we got married in a vineyard in Western Colorado with family and friends, and it became this destination wedding with beautiful backdrop, and it was amazing. So I also add that into the things that I'm taking from cancer.
That's awesome. I love that story. That's so cool.
I have to say, I think my husband freaked out a little bit when we actually won. Like, I was sure we were not going to win.
Awesome. Well, thank you so much for sharing all this with us, Erin. I know I learned a lot during my talk with you, and hopefully many others out there have learned a lot as well. So I want to wish you the best of health for many more years to come. And thanks again.
Yeah, thank you so much. It was so great talking with you, and thanks for having me on.
Yeah, you're welcome. Okay, important question time. I've interviewed survivors of 2 different types of cancers that are different from mine recently, and want to know if you want to keep seeing more of these interview type videos with survivors of other cancers. Let me know in the comments below, because I want to keep putting out content that you guys are going to keep coming back for. I promise I won't be offended if you say you don't want to watch any more of these interview videos. I want to make sure I'm spending my time putting together content that you guys are going to want to watch. If you've been a fan of these interviews, but you happen to miss the interviews that I did with colorectal cancer survivors diagnosed from stage 1 through 4, you can find those by clicking on the playlist right up here. Or if you've already watched those, then YouTube thinks that you'd enjoy this video from my channel. Thank you for watching.